What if I told you that right now, as you're watching this video, your kidneys might be silently failing, and you wouldn't even know it? Here's the terrifying truth that most people don't realize. Kidney disease is called the silent killer because 90% of people with chronic kidney disease don't know they have it until it's too late. That's according to the National Kidney Foundation, and it means that millions of people are walking around right now with kidneys that are quietly shutting down, mistaking the early warning signs for everyday fatigue or stress. Your kidneys are working 24 hours a day, 7 days a week, filtering about 50 gallons of blood every single day. They're like the ultimate cleaning crew for your body, removing toxins, balancing fluids, and keeping your blood pressure stable. But here's what's shocking. When your kidneys start to fail, they don't send you a dramatic signal. There's no sharp pain, no sudden collapse. Instead, they whisper their distress through subtle signs that most people completely ignore or write off as something else entirely. The Centers for Disease Control and Prevention reports that over 37 million Americans have chronic kidney disease, but the vast majority have no idea. And here's the part that should really concern you. Once kidney function drops below 60%, the damage is often irreversible. That's why recognizing these hidden warning signs isn't just important, it's potentially life-saving. Today I'm going to share with you 10 warning signs that your kidneys might be in trouble. Signs that are so subtle you've probably experienced some of them and never connected them to kidney health. These aren't the obvious symptoms that everyone knows about. These are the hidden clues that your body is trying to give you right now. And understanding them could literally save your life. Let's start with the first hidden sign, and this one is going to surprise you because it happens to almost everyone, yet nobody connects it to kidney problems. Have you ever noticed that you're more tired than usual, even after a full night's sleep? I'm not talking about being tired after a long day at work. I'm talking about that bone-deep exhaustion that doesn't go away no matter how much you rest. According to research published in the American Journal of Kidney Diseases, fatigue is one of the earliest and most common symptoms of declining kidney function, yet it's the one that's most often dismissed. Here's why this happens. When your kidneys aren't working properly, they can't effectively remove toxins from your blood. These toxins build up and make you feel exhausted. Additionally, healthy kidneys produce a hormone called erythropoietin, which tells your bone marrow to make red blood cells. When kidney function declines, less of this hormone is produced, leading to anemia, which causes that persistent, unexplained tiredness. The National Institute of Diabetes and Digestive and Kidney Diseases confirms that this type of fatigue often develops slowly, which is why people adapt to it gradually and don't realize something is wrong. They just think they're getting older or they're stressed. But if you're experiencing unexplained fatigue that doesn't improve with rest, especially if it's accompanied by any other symptoms I'm about to share, it could be your kidneys crying out for help. The second hidden sign involves something that happens to you every single day, multiple times a day. Yet you probably never pay attention to it, unless something seems obviously wrong. I'm talking about changes in your urination patterns. Now I know this isn't the most comfortable topic, but stay with me because this information could save your life. Most people think that kidney problems would cause obvious changes in urination, like blood in the urine or severe pain, but the truth is much more subtle. According to the National Kidney Foundation, early kidney disease often presents with changes that are easy to dismiss. You might notice that you're urinating more frequently, especially at night. This condition, called nocturia, occurs because damaged kidneys can't concentrate urine properly during the day, so your body tries to eliminate excess fluid when you're lying down. On the flip side, you might notice that you're urinating less than usual, or that your urine appears foamy or bubbly. That foam isn't just from the toilet water. Research from the Mayo Clinic explains that foamy urine can indicate protein in the urine, called proteinuria, which is one of the earliest signs of kidney damage. Your kidneys are supposed to keep protein in your blood. But when the filtering units are damaged, protein leaks into the urine, creating that foam. You might also notice changes in the color of your urine. While dark yellow urine usually just means you're dehydrated, persistently pale or clear urine, especially when you're not drinking excessive amounts of water, can indicate that your kidneys aren't concentrating waste properly. The key here is paying attention to persistent changes, not just occasional variations. The third hidden sign is something that affects your appearance. But it's so gradual that you might not notice it until someone else points it out, or you see an old photo of yourself. I'm talking about swelling, but not the kind you might expect. Most people think kidney problems cause obvious swelling in the legs and feet. And while that can happen in advanced stages, early kidney disease often causes much subtler swelling that's easy to miss. According to Harvard Health Publishing, early kidney-related swelling often appears around the eyes, particularly in the morning. You might notice that your eyelids look puffy when you wake up, or that the area under your eyes seems more swollen than usual. This happens because when your kidneys can't remove excess fluid efficiently, that fluid has to go somewhere, and gravity causes it to accumulate in the tissues around your eyes while you're lying down. You might also notice that your face looks a bit fuller or rounder than usual, or that rings and shoes feel tighter, even though your weight hasn't changed significantly. This is called fluid retention, and it's one of the ways your body tries to cope when your kidneys aren't maintaining proper fluid balance. The Cleveland Clinic notes that this type of swelling is often dismissed as allergies, lack of sleep, or eating too much salt, but when it's persistent and unexplained, it could be signaling kidney trouble. The fourth hidden sign affects something you probably don't think much about, unless it's really bothering you, but it's actually a crucial indicator of kidney health. I'm talking about your skin, and specifically, persistent itching that seems to come from nowhere and doesn't respond to typical treatments like moisturizers or antihistamines. Research published in the Journal of the American Society of Nephrology shows that chronic kidney disease often causes a condition called uremic pruritus, which is essentially itching caused by the buildup of waste products in your blood that your kidneys should be filtering out. This isn't just dry skin or seasonal allergies. This is a deep, persistent itch that can affect any part of your body and often gets worse at night. The National Kidney Foundation explains that this happens because when your kidneys can't effectively remove toxins from your blood, these waste products can be deposited in your skin, causing irritation and itching. You might also notice that your skin looks different, perhaps drier than usual, or with a grayish tint. Some people develop what looks like a fine white powder on their skin, which is actually urea being excreted through the pores when the kidneys can't eliminate it properly. What makes this particularly tricky is that most people try to treat the itching with topical creams or allergy medications, which provide little relief because they're not addressing the underlying cause. If you're experiencing persistent, unexplained itching that doesn't respond to typical treatments, especially if it's worse at night or accompanied by other symptoms I'm discussing, it's worth having your kidney function checked. The fifth hidden sign involves something that's absolutely crucial for life, yet when it's affected by kidney problems, the changes are so gradual that most people don't notice until it becomes severe. I'm talking about your breathing, specifically, feeling short of breath during activities that used to be easy for you. Now you might be thinking that breathing problems are related to heart or lung issues. And while that can certainly be the case, the National Heart, Lung, and Blood Institute explains that kidney disease can cause shortness of breath in two important ways. First, when your kidneys aren't working properly, fluid can build up in your lungs, making it harder to breathe. This is especially noticeable when you're lying down or during physical activity. Second, as I mentioned earlier, kidney disease often leads to anemia because the kidneys produce less erythropoietin, the hormone that stimulates red blood cell production. With fewer red blood cells to carry oxygen throughout your body, you'll feel short of breath more easily. You might notice that climbing stairs that never bothered you before now leaves you winded, or that you need to take breaks during activities you used to do easily. The American Journal of Kidney Diseases published research showing that shortness of breath is often one of the symptoms that finally drives people with undiagnosed kidney disease to seek medical attention. But by then, significant kidney damage may have already occurred. The key is recognizing when breathing difficulties don't have an obvious cause like a cold, allergies, or being out of shape. The sixth hidden sign affects something that's central to your daily interactions with others. Yet when kidney disease is the cause, it's almost never recognized. I'm talking about persistent bad breath that doesn't improve with good oral hygiene. This isn't the temporary bad breath you get from eating garlic or drinking coffee. This is a persistent, often metallic or ammonia-like taste and odor that seems to come from deep within. According to research from the American Dental Association, when your kidneys can't effectively filter waste from your blood, These toxins can be released through your breath and saliva. The medical term for this is uremic fetor, and it's characterized by a distinctive ammonia or metallic smell and taste. You might notice that you have a constant metallic taste in your mouth, or that others seem to step back when you're speaking to them. The Journal of Periodontology has published studies showing that people with chronic kidney disease are also more prone to gum disease and other oral health problems, partly because the toxins in their saliva create an environment where harmful bacteria can thrive. You might notice that your gums are more inflamed than usual, or that dental problems seem to develop more quickly despite good oral hygiene. What makes this particularly concerning is that most people assume bad breath is just a dental issue and focus on brushing more, using mouthwash, or seeing their dentist. While good oral hygiene is always important, if you're experiencing persistent bad breath with a metallic or ammonia-like quality that doesn't improve with typical oral care, it could be a sign that your kidneys need attention. The seventh hidden sign involves something that affects your comfort and quality of life every single day. Yet it's so common in our society that most people just accept it as normal aging or stress. I'm talking about persistent muscle cramps and weakness, particularly in your legs, that seem to happen for no apparent reason. The National Institute of Diabetes and Digestive and Kidney Diseases explains that healthy kidneys play a crucial role in maintaining the proper balance of electrolytes in your blood, including sodium, potassium, calcium, and phosphorus. When kidney function declines, these electrolytes can become imbalanced, leading to muscle cramps, weakness, and even muscle twitching. Research published in the Clinical Journal of the American Society of Nephrology shows that muscle cramps are particularly common in people with chronic kidney disease, especially cramps that occur at night or during rest. These aren't the muscle cramps you get after exercising hard or being dehydrated. These are cramps that seem to come out of nowhere and can be quite painful. You might also notice general muscle weakness, where tasks that used to be easy now feel more difficult. This can be related to both the electrolyte imbalances and the anemia that often accompanies kidney disease. The key is recognizing when muscle cramps and weakness are persistent and not clearly related to physical activity, dehydration, or other obvious causes. The eighth hidden sign affects something that's fundamental to your ability to think clearly and function effectively throughout the day. I'm talking about difficulty concentrating, memory problems, and what many people describe as brain fog. This is one of the most overlooked symptoms of kidney disease because it's so easy to attribute to stress, aging, or being busy. According to the American Journal of Kidney Diseases, the buildup of toxins in the blood that occurs when kidneys aren't functioning properly can significantly affect brain function. These toxins can interfere with neurotransmitter function and oxygen delivery to the brain, leading to problems with concentration, memory, and clear thinking. You might notice that you're having trouble focusing at work, forgetting things more often than usual, or feeling like your thinking is foggy or unclear. The National Kidney Foundation notes that many people with chronic kidney disease report feeling like they're not as sharp mentally as they used to be, but they often dismiss this as stress or getting older. Research from Johns Hopkins has shown that people with reduced kidney function perform worse on tests of cognitive function, including memory and attention tasks. The concerning part is that these cognitive changes can begin even with mild decreases in kidney function, long before other symptoms become obvious. The ninth hidden sign involves something that happens to everyone but becomes particularly problematic when your kidneys aren't working properly. I'm talking about how your body handles blood pressure, but not in the way you might expect. Most people know that kidney disease can cause high blood pressure, but what many don't realize is that changes in blood pressure patterns can be an early warning sign of kidney problems. The American Heart Association explains that your kidneys play a crucial role in regulating blood pressure by controlling fluid balance and producing hormones that affect blood vessel function. When kidney function begins to decline, you might notice that your blood pressure becomes more variable or harder to control, even if you've never had blood pressure problems before. You might experience episodes of high blood pressure alternating with periods of low blood pressure. Or you might notice that blood pressure medications that used to work well aren't as effective. Some people notice symptoms like dizziness when standing up, headaches, or feeling lightheaded, which can be related to these blood pressure fluctuations. Research published in Hypertension, a journal of the American Heart Association, shows that even small decreases in kidney function can affect blood pressure regulation. The key is paying attention to changes in your blood pressure patterns, especially if you're experiencing other symptoms I've mentioned. The 10th and final hidden sign is perhaps the most dangerous because it's so subtle that it can be dismissed as just part of daily life. I'm talking about changes in your appetite and unexplained nausea, particularly a persistent feeling of not wanting to eat or feeling sick to your stomach for no apparent reason, according to the National Kidney Foundation. When waste products build up in your blood due to poor kidney function, they can cause nausea and a loss of appetite. This isn't the temporary nausea you might get from a stomach bug or eating something that doesn't agree with you. This is a persistent feeling of queasiness that can make food seem unappealing, even foods you normally enjoy. The Journal of Renal Nutrition has published research showing that people with chronic kidney disease often experience what's called uremic nausea, which is nausea caused by the buildup of uremic toxins in the blood. You might notice that you feel full quickly when eating, that certain foods taste different than they used to, or that you have a general lack of interest in food. This can be particularly dangerous because poor nutrition can accelerate kidney damage and make other symptoms worse. Many people dismiss changes in appetite as stress, aging, or being too busy to eat properly. But when it's persistent and unexplained, it could be a sign that your kidneys need attention. Now that you know these 10 hidden signs, you might be wondering what you should do with this information. The most important thing to understand is that having one or even several of these symptoms doesn't automatically mean you have kidney disease. Many conditions can cause similar symptoms. However, if you're experiencing multiple symptoms that persist and don't have obvious explanations, it's important to talk to your healthcare provider about having your kidney function tested. The good news is that kidney function can be assessed with simple blood and urine tests. The most common tests include measuring creatinine levels in your blood, which is used to calculate your estimated glomerular filtration rate, or eGFR, and checking for protein in your urine. These tests are inexpensive, widely available, and can provide crucial information about how well your kidneys are working. The Centers for Disease Control and Prevention recommends that people at higher risk for kidney disease, including those with diabetes, high blood pressure, heart disease, or a family history of kidney problems, should be tested regularly. But even if you don't have obvious risk factors, if you're experiencing several of the symptoms I've discussed, it's worth asking your doctor about kidney function testing. Here's why early detection is so crucial. While advanced kidney disease often requires intensive treatment like dialysis or kidney transplant, early-stage kidney disease can often be slowed or even stopped with proper management. This might include controlling blood pressure and blood sugar, making dietary changes, taking certain medications, and addressing underlying conditions that can damage the kidneys. Research from the American Society of Nephrology shows that people who are diagnosed with kidney disease in its early stages and receive appropriate treatment have much better outcomes than those whose kidney disease isn't discovered until it's advanced. The difference can literally be years of healthy, productive life versus the need for intensive medical intervention. I also want to emphasize the importance of not panicking if you recognize some of these symptoms in yourself. Remember, many conditions can cause similar symptoms, and having symptoms doesn't automatically mean you have kidney disease. The goal of this information is to help you be more aware of subtle signs that might indicate a problem, so you can seek appropriate medical evaluation if needed. If you do have concerns about your kidney health, here are some questions you might want to ask your healthcare provider. Should I be tested for kidney disease given my symptoms and risk factors? What specific tests would be most appropriate for me? If tests show that my kidney function is reduced, what steps can we take to protect my remaining kidney function? Are there lifestyle changes I should make to support my kidney health? It's also worth noting that there are things you can do right now to support your kidney health, regardless of whether you currently have kidney problems. The National Kidney Foundation recommends staying well hydrated, maintaining a healthy diet that's not too high in sodium or protein, exercising regularly, not smoking, limiting alcohol consumption, and managing conditions like diabetes and high blood pressure that can damage the kidneys. One of the most important things you can do is to be an advocate for your own health. If you're experiencing symptoms that concern you, don't let them be dismissed as just stress or aging. You know your body better than anyone. and persistent, unexplained symptoms deserve proper evaluation. I want to leave you with this thought. Your kidneys are incredibly resilient organs that work tirelessly to keep you healthy, but they do their job so quietly that it's easy to take them for granted. By paying attention to these subtle warning signs and taking proactive steps to protect your kidney health, you're not just potentially preventing kidney disease, you're investing in your overall health and quality of life for years to come. The hidden signs I've shared with you today aren't meant to cause anxiety, but rather to empower you with knowledge. Knowledge that could help you catch potential problems early when they're most treatable. Knowledge that could help you have more informed conversations with your healthcare provider. And most importantly, knowledge that could help you protect one of your body's most vital organ systems. Remember, kidney disease might be called the silent killer, but it doesn't have to be silent if you know how to listen to what your body is telling you. These 10 hidden signs are your kidney's way of asking for help before it's too late. The question is, are you listening? If this information has been helpful to you, I encourage you to share it with the people you care about. Kidney disease affects millions of people, and many of them don't know it yet. By sharing this knowledge, you might help someone recognize important symptoms and seek the care they need to protect their health. Your health is your most valuable asset, and your kidneys play a crucial role in maintaining it. By staying informed, paying attention to your body's signals, and working with healthcare professionals when needed, you're taking important steps to protect not just your kidneys, but your overall health and well-being for the long term.